Hello there, I am Dr. Subramanian Kannan, Head of the Department of Endocrinology, Diabetes and Metabolism at the Narayana Health Hospitals, Bangalore. On this occasion of the World Diabetes Day, I would like to share some information that is very relevant in the management of diabetes. As you all know, diabetes is an ever-enlarging problem spreading across various age groups in the society. And to combat it, we have multiple tools. In addition to your healthcare providers who deliver you the best of care, it is also important for you to monitor your blood glucose. Amongst all the discoveries made in the field of diabetes, I am reasonably sure that monitoring of diabetes or monitoring of blood glucose levels stands at the forefront. Why do I say this? When you know what you're tracking, managing diabetes becomes a little bit easier. Let's take an example. I have somebody who's been diagnosed with diabetes through a routine healthcare checkup or an insurance checkup or a checkup in the office, and they come back and tell us, okay, this is my first diagnosis of diabetes and what shall I do? We provide them with appropriate diet and nutrition as well as exercise therapy to combat the diabetes. But how do we know if that particular strategy is working? The way to go ahead is to monitor your sugar levels at home. A lot of patients are quite satisfied getting a fasting and a post-breakfast sugar levels checked in a lab once in 6 months, once in 8 months. And they're quite happy and they say, okay, everything is okay. I'm around the 100 range, I'm around the 150 range, and I think things are okay. I would say possessing a glucometer at your home is a very valuable investment. The frequency and the aggressiveness with which you monitor your sugars may be dependent on your type of diabetes, the medicines you're taking, the insulin you're on. But for an average person who's newly diagnosed, we usually empower them or we tell them to get a glucometer to monitor their sugar at home. And I tell them, you monitor your sugars to begin with on a weekly basis. 1 week you choose your fasting and after breakfast levels. When I say after food, I generally mean 2 hours after the breakfast. 1 week you do your pre and 2 hours post lunch, and 1 week you do before and 2 hours after your dinner. When you do this for a month, you get about 4 sets of values. You are astounded to realize how things can vary between your various times of the day. And that gives you a lot of idea about how your body is metabolizing glucose over various time points. And this helps you fine-tune your diet and makes you adherent to the exercise pattern even more regularly. Some people want to have more data points. A continuous glucose monitor can also tell you how your sugars are behaving throughout the day. It captures readings every 15 minutes or in some of the occasions every 5 minutes to give you the data on a real time or on a live basis so that you can know what your sugars are at that point of time. This is one end of the spectrum where people can adjust or modify their lifestyle based on glucose monitoring. And again, this is an option. I think it's a very effective option. I particularly would recommend having or investing on a glucometer to monitor your sugars at various time points of the day to understand your body's metabolism better. Next comes the group of people who have been having diabetes for many years, are on medications, maybe they're also on insulin. I would strongly recommend that they go have a glucometer at home and monitor their sugars regularly. This again will tell us 2 things. One, about their diet and lifestyle. Also, it will tell us which medication is working effectively and which is not. Which insulin is working effectively and which is not. And this will again help us fine-tune the medications as well as the insulin doses appropriately. We frequently recommend for most of our diabetes patients to get an HbA1c checked every 3 to 6 months once, depending on their severity of illness. While the HbA1c gives you an average of sugar for an extended period of time, day-to-day fluctuations and monitoring patterns give you a better insight into the fine-tuning of medications and insulin doses as well. I may not be able to adjust somebody's insulin dose unless I know that that person is having a low sugar 2 hours after their dinner or at 2 a.m. or 3 a.m. in the night. This becomes a very important data point when you are able to capture that on a glucometer. May not be visible or may not be apparent on a HbA1c or a fasting and postprandial sugar levels checked in a lab. So this is the second group of patients where it is strongly recommended that they go on with a glucometer reading. They can also wear the continuous glucose monitor if needed on a regular basis or on an intermittent basis as per their doctor's recommendation. The last group of patients who have type 1 diabetes or because of some problems to their pancreas are on insulin lifelong. They are on 4 injections a day every day. And this is a difficult diabetes to manage because there are frequent low sugars and high sugars. Matching the insulin to the carbohydrates in the food is the crux of the management of these patients. And for these patients, we strongly recommend that you go on to a continuous glucose monitor. If you're not able to afford it every day, at least 15 days a month, if you can invest getting the continuous glucose monitor, it will give you valuable information about your own body's response to insulin, physical activity, food intake, snack intake, sugars during the night at 2 a.m., wherein which you can adjust your insulins along with the help of your doctor and your diabetes nurse to ensure that you stay in the appropriate good glycemic range throughout your day, throughout the week, throughout the month and throughout the year. So the point that I'm coming to by giving all these examples are we are slowly moving away from just an average glucose level to a concept called time in range, which means we really want your sugars to be within a certain time, within a certain limit or a certain range, and keep the sugars in that range without much fluctuations. So if your sugars are hovering, say, somewhere between 100 to 180 or 120 to 200, and it maintains in that level without much of lows or without much of highs, you spend about 75% of your glucose levels within that range, then we are quite happy that this is reasonably well managed, and in turn you will effectively also keep your HbA1c under a good control, close to 7.5%. So I think it's extremely important that we move from just a static value checked once in 3 or 4 months to a more real-time value. This may be less intense when you're newly diagnosed or you're on medications that don't cause low sugars. It becomes moderately intense when you're on multiple medications or once or twice insulin, and it becomes quite intense monitoring when you're on 4 times of insulin a day. So the message to patients who have diabetes: take charge of yourself. Be on top of things. The only way to do that is to have the data of your glucose levels. The glucose monitors are fairly reliable, and the sensors that we have that are available in the country are fairly reliable, and one can use them to track your sugar levels on either a weekly basis or a daily basis or a hourly basis. So empower yourself with glucose data, use them along with your physician's help to adjust your medications and modify your lifestyle and help keep the risks of diabetes complications at bay and have a healthy and productive life. Thank you.